I'll just transfer it something.
Yeah, yes.
And then Aster RV Hospitals. Thank you.
Its patient-centric approach, driven by medical innovations and a culture of excellence, need a special healing touch. We go beyond all boundaries to give you that extra smile on their face. We have specially designed services for elderly people with extra care and comfort. If in your family doesn't go unnoticed, we celebrate with you. Feeding children with the extra touch of affection is one of the unique features. Nutritious diet and ensure care that makes your child feel it.
And see today where we are spread across 9 countries with more than 350 establishments.
Has joined hands with the Rashtriya Shikshan Samiti Trust.
The second hospital in Bangalore in association, and we assure you that we will
Innovation and culture of excellence.
best possible equipments. A few quaternary care departments, which is the real need of the community and the citizens.
On stage, these 3 eminent personalities so that we can introduce them to organization. Please welcome Mr. Sapaldas.
I just like to brief you about the hospital, the main branches of Aster. Okay, we are also coming up with another 2 hospitals which will be in Bangalore and all spread out all across India and Asia Pacific. Bangalore facility. So we have currently in Hebbal, Whitefield and JP Nagar. We employed with 197 doctors. Then this is the new upcoming hospital, specialty tertiary care hospital in coming days. Specialty which we gonna be talking about, this is the neurologist. As you can say, I have already given a couple of doctors demonstration over here. So we have around 55 doctors. I will be sharing all the doctors list with you in a couple of days. Who are the doctors? So it's a huge pediatric facilities which we are having. Next slide. Now coming to oncology, so the onco team, we have Dr. Vikram with us today, who is heading the head and neck onco part. We have a medical oncology team which is headed by Dr. Vijay Agarwal, and we have also radiation oncology, medical oncology, and stem cells bone marrow transplants with adult and pediatric surgeries.
Yes, I would welcome you all from Aster Neurosciences, Bengaluru. Bangalore is a very beautiful place. You're all welcome there. You would really love to be there. I'll just talk to you about what we are doing in Aster Neurosciences, Bengaluru, because neurosciences has taken in a big way in Aster Hospital because it's been given a lot of prominence there. And a lot of investment has gone in, and we have got some of the best talents in Bengaluru in neurosciences in our team. So I'll just introduce you. This is Aster CMI, that is Aster RV, as you already been updated. So this is our team of neurosurgeons. This is Dr. Ravi Gopal Verma. He's the functional neurosurgeon. He's one of the brain. It's at the left side. Left side is the place where it comes. And then after the craniotomy, the tumor we remove it. And once we remove the tumor, so the same patient after the surgery. After the surgery, patient will not be able to talk or will have a week in our hands. So there's another type of surgery.
So we have seen that technology is advancing, and we are using technology in the neuroscience and various other fields of medical science. So now we are going to look after other fields of science and medical science. So it is my absolute pleasure to bring on the stage Dr. Vikram Kaikatapura, who will share his thoughts and ideas with us. with an award for Best Research Paper from the Foundation of Head and Neck Oncology in India and a valued member of the American Association of Cancer Research, Dr. Vikram Kaikatapura is at our absolute forefront in the head and neck oncology, especially at Astor Hospital. So a round of applause for Dr. Vikram Kaikatapura.
Absolute pleasure always to see so many friends here. I've been coming to Dhaka for quite many years, and there have been a lot of friends here, and many of them are in the crowd today. Of course, we're going to make some new friends also today. So I'm just going to come little below the brain, that is the head and neck oncology. We just heard what magic can be done in the brain. Now, can we do some magic below the brain also? And that's where I'm going to talk about oncology. Cancer, it is a scary word. Nobody wants to actually hear about cancer. Once cancer word comes, everybody, including the patient, family, and believe me, even the doctors are scared. So in that way, what is that cancer? We, as in South Asia, India or Bangladesh, we have fairly common kind of cancers. See, majority of our cancer for last 30-40 years was because of tobacco use, tobacco chewing.
So as you've heard my colleagues talk about the kind of surgery that we do, I predominantly do liver transplant and liver cancer surgery, and we have quite a large department. We've recently completed more than 500 liver transplants. So you know that when we start doing surgeries, we cross milestones, 100, 200, just like cricket. We finish 100th century, second century, third century, and every time we have to reflect. We take a step back and understand what have we learned so far. What are the things that are there? Are we going in the right direction? Are we losing our way? This is the time for us to philosophically look at what we have done. So when we look at our journey over the last 5 years, over 500 cases, we have, the glass half full and glass half empty. I can just see that our glass is half full, and I wanted to list out some reasons why I feel that optimistic about how we can treat. And after implant, you can see it looks very healthy, and we will do an ultrasound scan just to make sure that all the blood vessels are working. The main blood vessels of the liver have joined, and the liver looks very, very healthy. And we start doing the transplant, you can see the liver coming back to life, that the color changes from a pale brown. Again, like we said, we can split a liver. We have already talked, the liver is got 2 years and something called bloodless liver transplant. So we have reported the first time refused to take any blood transfusions such as Jehovah's Witnesses successfully. We are one of the technology which are all across the world, and some of which we have developed as well. So mother wanted to donate liver to her. So without even, we have also taken it to the next step. Now we can create a 3D print. The other big thing that we do is preserving the organs. Now you know that when we take the organ out of the donor, we should. So thanks to this machine, it is basically circulating blood inside the pale to red.
Hospital.
Okay.
And post-procedure stay in.
আমরা এখানে অনেকে আছে যারা মেডিকেল নিয়ে কাজ করে থাকি, আর জানি না এখানে কতজন আছে আমাদের এখানে মেডিকেল নিয়ে কাজ করছে অবশ্যই।
আমি অ্যাজ এ পেশেন্ট হিসেবে একটা ভিসা নেওয়ার পর আমার মনে হলো আমি
for concerned hospital. We get two things. One is staying time, another is mode of treatment, and third,
the government has to be strict in this part. Once they are going, what happened usually during COVID time, I mean, even
it prefers to go for trial chemotherapy. So for patients who will
require surgery first, followed by radiation and chemo. So that standard international norms are well established in oncology for a cure perspective. Then we can cure a patient we know.
আপনাদের মধ্যে কেউ যদি ছবি তুলতে ইচ্ছুক হন তাহলে
আসসালামু আলাইকুম, আমি ডক্টর হরি প্রকাশ, আমি অ্যাস্টার নিউরোসায়েন্সেস বেঙ্গালুরু থেকে আসে। Astor Neurosciences Bengaluru is one of the excellent centers in which we have one of the most sophisticated equipments. We have intraoperative MRI, navigation, intraoperative monitoring systems, ultrasound, और हमार एखाने आसे हाइब्रिड कैथ लैब जे जगह अपनार
ইন্টারভেনশন বি করতে পারে, সাথে সাথে অপারেশন বি করতে পারে। সো দিস সেন্টার হ্যাজ গিভেন আস দি মোস্ট এক্সেলেন্ট equipments along with some of the most excellent doctors that we have. Like we have our team of doctors led by Dr. Ravi Gopal Verma, who is functional neurosurgeon, pioneer functional neurosurgeon in India, and Dr. Umesh Srikanta is a spine surgeon. Our আমার সঙ্গে আমি ডক্টর হরিপ্রকাশ ইন্টারভেনশন নিউরোসার্জন অ্যান্ড এন্ডোস্কোপিক স্কাল বেসড নিউরোসার্জারি করে, আর সাথে ডক্টর কামলে আছে, উনি বি ইন্টারভেনশন নিউরোসার্জন আছে। তো অনেক রকমের ট্যালেন্টস আর স্পেশালিস্ট ওখানে আছে, সাথে উই হ্যাভ সাম অফ দি বেস্ট ইকুইপমেন্টস অ্যান্ড উই হ্যাভ মোস্ট এক্সপিরিয়েন্সড টিম অফ ডক্টর্স লাইক ইন্টেন্সিভিস্ট or ICU care. So this all makes us some of the good place for any patient to come and get treatment, where because you are in one of the safest hands. And anyway, Bangalore is a very beautiful city, so people can always come in there, and then our hospitality is very good. এই বাংলাদেশে তো রোগীগুলা অনেকগুলা আছে কি যে নিউরো মানে সমস্যার জন্য যে ট্রাবল আছে ওনার, আর এখানে লোকের ট্রিটমেন্ট তো পাইতেছে এখানে, বাট অনেকজন ইন্ডিয়া আসতেছে। তো ইন্ডিয়া আসার পর অনেক জায়গা ঘোরাঘুরি করে, আর মানে দে আর নট কমপ্লিটলি গাইডেড ওয়ের টু গো, হোয়াট টু ডু, ওয়ের টু গেট আ প্রপার ট্রিটমেন্ট। And this is one of the reasons why we came to Bangladesh. এখানে আসার পর we have been able to tell what we are doing and what best treatment that we can offer. So they don't have to get misguided. They can go to the best center in India and get the treatment. So this is one of the reasons why we have come to Bangladesh to tell the public that to get treatment in a proper, safe center.
Hello, I'm Dr. Sonal Asthana. I'm the lead consultant and program director of the Aster Integrated Liver Care Group at Aster CMI and Aster Harvey Hospital in Bangalore. My specialty and interests are essentially liver transplantation, both adult and pediatric. We also perform complex hepatobiliary surgery, that is surgery for cancers of the liver and the pancreas, as well as vascular reconstructions. We pride ourselves on doing cases that are too complex for other people to handle, primarily because of the expertise that we have both in the surgical field as well as the anesthesia and the critical care field. What's novel about our program is our large pediatric liver transplant program, which is one of the largest in the country. We have a unique mechanism of supporting these patients and and can take on even more complex patients, patients with babies less than 5 kilos of weight, or patients who have multiple challenging problems. These are the areas that we specialize in. So if there are patients who need our help in terms of liver disease, liver cancer, liver transplant, pancreas disease or pancreas surgery of any sort, then these are the areas that we normally cover. I do a monthly clinic in Calcutta, and we do treat a large number of patients from Bangladesh and the outpatient. Very recently, we have actually operated on an 8-month-old baby who was from Bangladesh, who presented with a tumor in his liver. We were able to do that tumor laparoscopically to a large part with a very small incision. So the baby is recovering very well at this time. We do get a large number of patients from Bangladesh because we see that liver disease and liver cancer is actually unfortunately very common among patients from Bangladesh.
Thank you.
You're very welcome.
Hi, I am Dr. Vikram Kaikatapura. I am a head and neck cancer surgeon. I deal with the cancers of oral cavity, that is mouth, throat, voice box and thyroid, which are one of the commonest cancer which we see in our part of the world. Head and neck cancers are mainly the lifestyle related cancer, tobacco chewing, gutka, smoking. These are the most common factors which cause these cancers. About 30-35% of population use some or other form of tobacco, and that's the reason these are one of the most common cancers which we see in South Asia. These cancers, if managed well, have a good prognosis. So therefore it is important to make early diagnosis, to make a proper treatment plan, and plan for a curative intent treatment. Reconstruction and functional rehabilitation following surgery is the key to achieve good quality of life after the treatment for oral cancer. Thank you.
And you have.
So in my 20 years of practice, I have been fortunate enough treating many Bangladeshi patients from West Bengal, because these are the hub of head and neck cancer. Naturally, my experience in dealing with patients from Bangladesh is much more, and I sometimes feel it is very important that we connect early, because many times it happens that people from Bangladesh reach us in very advanced stages, mainly because they don't know exactly where to go. Also, there are delays in arranging funds, visa problems, other issues. So I think it is very important that we facilitate and this treatment much better, so that we can give best of our treatment to our patients from Bangladesh also.
Thank you.
Right?